I think that one of the first things that they were looking at was mental health because they know that while this wasn't the entirety of what happened with Sonia Massey, that this was a huge part of it. If we have first responders who are not equipped to deal with mental health issues, then we can very quickly take a crisis that someone is having and then turn it into a violent situation that isn't helping anyone or that ends in death the way that it did. I think that most of our mental health systems right now are just kind of fragmented. We have this whole, the right hand doesn't know what the left hand is doing sometimes. We don't also have any accountability to those services that make sure that they get out to all of the people. The best way to honor her is to do the work to make sure that it doesn't happen to anyone else. The best way to honor her is to say, we see you, we see what happens to you, we're going to pay attention to the systems that failed you, and we're going to work together to make sure that they don't fail another person.
We are the same as a lot of families in Springfield. We have our mental health issues. We don't really know where to go. We need to start somewhere. And I think the 708 Mental Health Board is something that we have desperately needed in this city.
We don't have a co-responder unit. So while mobile crisis is available to us, we do not have the partnership to fund an actual mobile health caseworkers to ride along with the deputy. They let the staffing know what is out there, how to get those resources, and they actually link them to those resources.
It's gotten a lot worse when people are in a psychosis state. We can't provide care for them. A lot of times they are diverted to hospitals, but the hospitals can't do much for them either. My hope is that we can get these people some help. I cannot provide for these people when they're in the jail. It's going to be a community thing.
I think if we would have had a mental health board, 10 years ago, we'd be a lot further along than what we were. I think a mental health board brings stability and consistency, even hope. So if we have a constant, stable means of resources, programs are looked out for years to come, that's not ebbing and flowing with what grants are coming and going, then yes, I think we can. And I think a mental health board within our community would stabilize a lot of that and save us money.
One of the biggest challenges we see is meeting their basic needs on a daily basis that affects them academically, it affects their social emotional learning, it affects their family, just across the board. Mental health then it is a struggle for them. Finances and being able to provide for the family, that also kind of ties into mental health, and just transportation in general to get students to where they need to be for appointments and things like that.
Funding for curriculum, being able to utilize resources to teach our students how to deal with anxiety and anger and conflict resolution. Another major thing would be transportation, helping our students get to the resources that they need in Springfield because we don't have access to them in Auburn or Dyburn.
The gap is more so parents understanding what's available to them and knowing when and where to reach out to individuals to get the support. If we did have funding to be able to have a co-responder embedded with county, it would bring mental health out to individuals more rapidly.
We've had, unfortunately, suicides and things in the agriculture industry for many, many, many years. Any opportunity for us to work together collaboratively is always a better option. The issues are real, the outcomes are real, but they're preventable. And with proper services and resources, I think we can make an impact with that.
The guys especially don't talk about it. You know, they laugh and they go to the coffee shop and they talk about the weather and the crops, but they don't talk about their feelings or emotions, I guess. If you let it go, it builds up, and where it gets to the place where you can't handle the stress. And we've known people that have committed suicide, or they'll go to drinking or drugs or alcohol, and just do things instead of seeking out good mental health solutions.
It's definitely real, and it's growing at a rapid rate. I feel like if we don't put our hands on now, it's gonna get even deeper and worse, So men's mental health is some on the back burner, I feel like. It's not a lot of outlets, you know what I'm saying? Men try to cope with their problems within themselves or within their family or friends. Or it's not a lot of trust, you know what I'm saying? I believe it's a lot of distrust. So a lot of men tend to just cope with their problems.
It's important to note that mental illness is the leading cause of disability in the United States and Canada. We have a lot of gaps, and that's not unique, but we have gaps in crisis services especially, and I think that's where people tend to really focus because it affects so much of the community. We just don't have the resources to be able to implement the array of services. There's a workforce issue as well. We don't have enough people, and the people aren't necessarily trained in some of these other types of interventions. And then the final barrier is really the desire from a community level. I've been in communities where we have tried to implement some of these programs, and if people aren't willing to participate, aren't interested in participating in that way, they're just not going to be successful. The treatments for mental health are more effective than cutting-edge cardiac treatments. So mental health treatment works, but it needs to be more than just medications and therapy.
We really have changed the face of human service in the county as the result of our funding over the 5-year period. We've reduced the number of behavioral incidents in emergency rooms in our hospitals by 60% over the time. That's a huge benefit both for the people and for those services. State money is not available to do mental health in the way that used to, okay? And it appears that neither will federal money be available to be helpful to a county as large as Sangamon.
Sonia's here and she's smiling. And I think she knows that this work is for the betterment of Springfield. And that's what she really wanted. She wanted to change the world, and I think the Massey Commission, 708 Mental Health Board, and a lot of the things that are coming in the future are just the beginning of that.